Greetings and welcome to AWHONN Insights, the home for candid nursing conversations. I'm your host, Bria Anopise, and we're recording this podcast at the 2024 AWHONN Convention in Phoenix, Arizona. Today, we're joined by Mary Dawn Koenig, Dr. Mary Dawn Koenig from the Board of Directors. She's an associate professor at the University of Illinois Chicago College of Nursing. Her research focus is studying how maternal and child health outcomes are affected by the bidirectional relationship between nutritional status and the development and function of the body's immune and inflammatory response. Our other guests are our partners in the Collaborative for Alcohol-Free Pregnancy, NPs, midwives, and nurses, partnering to prevent FASDs. Gina Shoemaker, an advocate who experiences fetal alcohol spectrum disorder. She's the vice president of the board of directors for the Alaska Center for FASD and wants to share with our listeners how to work with someone with a brain-based difference. Lily Bastian dedicates her practice to providing comprehensive midwifery care to all individuals. Her research interests include the evaluation of psychosocial issues with young people living with HIV, trauma-informed care, sexual and reproductive health, and the prevention of FASD. Alexandra Edwards is a senior research professional and program manager with the Center for Behavioral Health Research and Services through the Institute of Social and Economic Research at the University of Alaska Anchorage. Other projects she's currently focused on are expanding the Alaska public health workforce and Alaska Native communities advancing vaccine uptake. It's a pleasure to have you all on. Our co-hosts for today are Jessica Irobali, Director of Collaborative Programs at AWHONN. She has an extensive experience as a perinatal high-risk critical care nurse and co-leads the Obstetric Patient Safety Program. She's led the expansion of the post-birth warning signs and education toolkit, as well as the translation into over 20 languages. And Kimber Stovison, labor and delivery nurse, student midwife, and our very own 2024 emerging leader. Jessica and Kimber, I now turn the podcast over to you.
Thank you, Bria. I'm super excited about all our guests and can't wait to dig into fetal alcohol spectrum disorder. So the first question I'm going to go ahead and ask Lily. There are many different definitions for neurodivergent patients. Can you tell us what a good definition is out there?
Yeah, that's a great question. Neurodivergent means that a person's brain functions differently than what may be considered neurotypical. We often hear about neurodivergent in the context of autism or ADHD because they're diagnosed much more frequently than FASDs, although FASDs also sit firmly in the neurodiversity space, and they're highly prevalent. Neurodiversity is used in the context of brain differences, not deficits. It's a social understanding of brain differences rather than a medical diagnosis. While people who are neurodivergent have all sorts of strengths and talents, they do often have difficulties navigating a world that's designed for people with neurotypical brains, and therefore can really benefit from accommodations, supports, and services. When it comes to people with FASD, these supports really need to be FASD informed in order to be effective. There is a lot of neurodiversity within the FASD community as well, because no two people with FASD have the same sort of brain differences. Neurodiversity implies the need for systems of care to be inclusive of all human neurodiversity existing on a spectrum.
Thanks for that definition, Lily. Gina, I wanted to know if you could just share with us what life can look like living with fetal alcohol spectrum disorder.
Sure. I was diagnosed at 50, and it was life-changing for me. Having modifications in place has helped me immensely. I've not lost a driver's license or locked my keys in the car since I've been diagnosed because I'm aware of my difficulties and challenges. And I've gotten to know more about my strengths, and that is trying to teach more people about FASD and trying to end the stigma surrounding that. It's a challenge every day, but I find that knowing that I have it has helped me to figure out and put the pieces back together.
Thank you for your open honesty and sharing your lived experience with FASD. Are there any tips or things that you think are important for nurses and other clinicians to know that care for these patients?
Actually, there's several. Being neurodivergent means that I need you to be able to talk in clear language, talk slow. When you're showing me my labs, if you turn the screen around and show it to me while you're telling me what my labs are, it's going to be a lot easier for me to understand. My doctor texts me the week before, the day before, and the day of my appointments, which really makes it a lot easier for me to make those appointments. And I think that being able to be open with your doctor and letting them know you need extra time, that you can't get an appointment in 15 minutes. It doesn't work for us because we have a slower processing time.
We've been educating on alcohol and pregnancy for many years. Lily, why do you think that some people choose to drink while pregnant? For example, the data on unmarried women over 35 with higher education levels, and how prevalent is fetal alcohol spectrum disorder?
Yeah, so first and foremost, it's really important to remember that people don't drink during pregnancy to intentionally harm their children. Many people aren't aware of the risks of the alcohol while using it during pregnancy, or sometimes they don't even know they are pregnant, or they do need help to stop drinking. Most people stop drinking when they find out they're pregnant, but oftentimes that doesn't happen until 4 to 6 weeks into the pregnancy for someone with a normal cycle. So this means a person might be drinking and exposing their developing baby to alcohol without even knowing it. And many people do still hold common misconceptions about the risks of alcohol use during pregnancy. And there's a lot of mixed messages for pregnant people. Like, for example, sometimes there's types of alcohol that some people say are safer in pregnancy, like red wine. And actually, there's just no safe time and no safe type and no safe amount of alcohol used during pregnancy. So an FASD is very prevalent. It's not rare. Research shows us that 1 in 20 school children in the US live with FASD. So it is also vastly underdiagnosed and underrecognized. So that 1 in 20 is likely more. And that's also important to remember that when we say 1 in 20 children, that, goes on in a lifetime, right? So 1 in 20 adults. So if you are a nurse or a provider seeing patients, and let's say you have 20 patients in a day, 1 out of those 20 will have an FASD. So, it's important that, once they find out they're pregnant, that they stop drinking, and many do right away. But sometimes people struggle and need our support. And the most important thing is to realize that for some people, it's not a choice to stop, and that we really need to look at, the word of choice. It continues to stigmatize those that struggle with drinking alcohol during pregnancy.
Thank you for that data and sharing that information. So you said 1 in 20. Now I know, Mary Dawn, that you've done some research as to why we might not know that from like the clinician perspective, or why it's not being shared. Do you want to tell us a little bit more about that?
Sure, yes. In my work, I ask my participants to give me an account of their nutrient intake. And part of this nutrient assessment includes alcohol intake. And what I'm finding in my work is that many individuals who are pregnant actually report intake of alcohol to me and my research team, yet they do not report this to their providers. And this is most likely due to stigma around the intake of alcohol during pregnancy and the fear of judgment.
And maybe the fear of having their infant or newborn taken away, right? So how about, Alex, can you tell us more about alcohol screening, brief intervention, and reimbursement, not only for our nurses, but all healthcare providers?
Yeah, sure. So alcohol screening and brief intervention is an evidence-based strategy that is recommended by the US Preventative Services Task Force and the CDC and the Substance Abuse and Mental Services Administration. It is relatively simple to do. It takes about 2 to 10 minutes, which can be spread out across the appointment and supported by multiple staff members. So it doesn't necessarily need to be done all by one person. And nurses and midwives are actually uniquely positioned to affect this small change. Nurses are among the most trusted healthcare providers, right? And so what an amazing position to be in, trusted in that position to provide trusted information to people who are perhaps in that part of their life where they are most likely to make a change, right? Because when you find out that you are pregnant, that is documented research to be the most likely part of a person's life when they are most likely to make a change. So like I said, it takes about 2 to 10 minutes, which can be spread across that appointment. There is significant value as well in simply raising the topic. Part of alcohol screening and brief intervention is not to say, you must stop drinking. It's to provide the information about the risks of alcohol use during pregnancy. It's about providing that education and then allowing that person to make that decision for themselves. It's about checking in with the patients about alcohol use. And one of the things that we do as part of the Collaborative for Alcohol-Free Pregnancy and as part of the wider effort around promoting alcohol screening and brief intervention is to make this a universal practice so that we're asking all people about their alcohol use. Because it's not just alcohol use during pregnancy, alcohol affects all physical, psychological, social systems. And so if we are asking everybody about their alcohol use, we can potentially decrease the stigma associated with being asked. And then everybody becomes perhaps a little bit more comfortable with being asked. We reduce the judgment, and then we can perhaps avoid some of the negative health impacts across the board that are associated with alcohol use, including alcohol-exposed pregnancies, but also some of the cancers that we know are associated with alcohol use. Some of the other health impacts, the cardiovascular issues, cirrhosis of the liver, a lot of the other things that you probably are also aware of. Most SBI clinical encounters conclude with a brief conversation, brief education, and there's no need for referral. Most people are drinking within, we won't say, no risk limits, but within limits that could benefit from education around what is risky drinking, what is excessive drinking, what is binge drinking, so that they can make educated decisions for themselves and their health and well-being. So that is really the purpose of it. And if for some reason the practitioner comes across someone who could benefit from more assessment or referral, there are resources that are available to refer that person to. And we have made those resources available to Bria, including reimbursement information, because you can be reimbursed for some of these services. It does vary state by state, so I can't say it's this, this, and this on this podcast, but be aware that you can be reimbursed. It just takes a little bit of time to figure out where that reimbursement comes to for your particular clinic, for your particular state. So we have provided some resources to help you figure that out.
Alex, thanks so much for bringing up that point about nurses being one of the most trusted professions, because that really does lend itself to nurses being able to have a pretty large influence with some of these screening tools. With that information, this question is for Lily. Where can nurses learn more about alcohol SBI and earn continuing education to understand the importance of delivering this brief intervention to patients who screen positive?
Yeah, we have a variety of places, most of which are linked through our website at tinyurl.com/askabout-alcohol. But some quick examples, the CDC has online trainings that are really great. And some of them even have continuing education, so there's a little bit of motivation there. Our partners with NPWH also have continuing opportunities and continuing education. Our national partner network, our FASD national partner network, including ACOG, have trainings on their website too. So, and if you're at AWHONN this weekend, specifically the Monday actually afternoon, we will be doing some practice sessions on facilitating culturally safe conversations around substance use and contraception. So you can come and try out your skills with us too. In the coming year, we plan to develop a workshop with continuing education attached to it also. So this is really an ongoing effort. We work really hard to make sure our trainings and resources are continually updated to reflect the latest research and recommendations for nurses and midwives and providers.
I think this is a good segue. I'm glad that you brought up your partners with NPWH. So now I know that you all have been collaborating with AWHONN, the University of Alaska, and NPWH. So what were the benefits and how did you meet your FASD National Partner Network goals? And I believe this is for Alex.
Yeah, that's a really good question. So bringing the resources of not only UAA, AWHONN, and NPWH, but we also bring the resources of CDC, so the Centers for Disease Control and Prevention, who funds this work, and also our fellow grantees at the CDC's National Partner Network, including ACOG and FASD United. And we are really trying to work very closely together to share those resources to make this an interdisciplinary effort, because nurses and midwives, nurse practitioners, they don't work in a silo. They don't work by themselves. They work with physicians. They work with social workers. They work with medical assistants. And so we are really trying to make sure that this is an interdisciplinary effort, share these resources, and push those resources out together. So again, if you're at AWHONN this weekend and you come by our booth, you'll see that we're sharing resources from ACOG and FASD United, and just really trying to make sure that this is an interdisciplinary effort. We're really trying to raise awareness about how all healthcare providers can raise awareness about FASDs and alcohol-exposed pregnancies to reduce the potential harm caused by excessive alcohol use. And our champions, and by the way, we are always seeking new champions. So if you would like to be a champion, or if you are thinking about being a champion and you don't know what that means, you don't know what it might involve, come and talk to us. It can be as simple as just putting up a poster in your clinic. That is being a champion, right? Sharing materials about a coming training. That is being a champion, right? So it's not necessarily going out and doing a training and being an expert in the topic. A champion is someone who is interested in something and spreading the word and spreading awareness. That is being a champion, right? So if you're interested in being a champion, want to sign up for our mailing list, be kept up to date on new trainings, new resources, please go to our website, sign up for our champion mailing list, and we can keep you updated on that. And you can help us spread the word about this work among your colleagues and among your patients. We have tons of patient resources as well, not just from us, but again, from our colleagues too. Okay. Yeah.
I can attest that all of that information is available at your booth, as I just left your booth right before we came here. I do have another question for you, Alex. In terms of population demographics and geographical location, where are you all observing patients experiencing substance use disorders?
Yeah, that's another really good question. I think it's really important to know that substance use and alcohol use are not limited to any one part of the population, and that discussion about substance use and alcohol use should be discussed in the context of full physical and mental health. This is why we support universal alcohol screening for all people ages 18 years and older, because excessive alcohol use can affect all parts of our bodies. And you can't just assume from someone's demographics that they do or do not drink. People are complex. Risk factors are also complex. Demographics are only one part of that equation. There are also other things that may contribute to a person's risk for developing an alcohol use disorder, such as age at first drink. The earlier that someone starts drinking, the more likely it is that they may develop an alcohol use disorder, for example. Exposure to trauma, whether they may experience a mental health condition such as anxiety, depression, or post-traumatic stress disorder, none of which you will know just by looking at a person. And even though a person may or may not have experienced those things, it also doesn't mean that they will go on to develop an alcohol or substance use disorder. So this is part of the rationale for universal screening, right? Because you can't make those assumptions, we really need to be having these conversations with everybody. And it goes back to what I was saying earlier. If we're asking everybody, then we can hopefully reduce the stigma, reduce the judgment, identify people before they develop an alcohol use disorder, right? Before they go on to develop these other health conditions that we know are associated with excessive alcohol use, and prevent them, right? Because that's what we want to do. We want to prevent these things before they happen. That is part of this prevention strategy. Does that answer that question?
Yes, that does. I think it is very important to normalize it and reduce the stigma and just go to universal screening to make sense. And thank you so much for the multidisciplinary approach. I think it's really important that we all speak the same language. And so with that, I want to ask Lily, what suggested approaches do you have for all clinicians that are talking to patients that are dealing with SUD or substance use disorder?
Yeah, when approaching a patient or a client with substance use disorder, care should be taken to really show compassion and understanding and, not be judgmental. The language we use matters, and this language should really be stigma-free. Nurses can serve patients and clients with substance use disorders by empowering them with accurate information and referrals to treatment and services.
And I think the best way is practicing. So when you do that workshop, I would love to see that. I'm going to try and come so that I can simulate and see how skillful I am at that in convention. So I'm going to go ahead and pass it on to to Kimber or Bria. Is there any other questions or anything that you guys want to say before we go to Bria?
Thank you all for being here and taking the time to answer some questions and kind of help guide us in the way that we should be working with this patient population.
All right, this was great. I actually learned a lot, and I'm so grateful to you all for being here. So thank you, Mary and Gina, Lily, Alexandra, Jessica, and Kimber, for this in-depth conversation on caring for people who are neurodivergent, affected by fetal alcohol spectrum disorder, and or experiencing substance use disorder. Our nurse, midwife, and nurse practitioner colleagues, they are trusted partners who can implement these evidence-based practices and reduce the stigma and judgment. I like that phrase, when you all said people are complex. I think that's really important to keep in mind. It's also important to understand that FASD is not rare. So 1 in 20 is a pretty common number. I also want to reiterate that there's no safe time, type of alcohol, or amount of alcohol during pregnancy. So for our listeners, thank you for tuning in and giving us the privilege of your time. Please share how much you enjoyed this episode by leaving us a review and telling a colleague or friend to listen in. You can visit awhon.org/podcast to read our guests' full bios and download the treasure trove of resources that they have shared with us today, even before this podcast. And especially if you would like to become a champion, I know they would welcome you. You're definitely guaranteed to learn more. You can listen to AWHONN Insights wherever you stream your podcast. You can also watch this on YouTube. Thank you all so much for your time, and be safe.